In the winter of 1997, Dr. Jagjit Sangera held two meetings, one in the UK and one in India, to discuss the possibility of building a hospital to serve the people of Bilga. From these meetings and through the hard work of Dr. Jasvinder Singh and the India subcommittee, the Bilga General Hospital opened its doors to its first patients on the 31st of March 2005. The hospital had one simple goal: to establish effective primary and secondary care for the people of Bilga and its surrounding area. This was to be on the basis of need and not of gender, creed, race or nationality. In the beginning, it provided a 24-hour accident emergency service, a diagnostic centre, operating theatres, an eye department, maternity and childcare facilities, and a mortuary service. Over the years, the hospital's grown. It now has 48 beds serving those in need in the village of Bilga and the surrounding 44 villages and towns. These facilities have been made possible because the Bilga General Hospital Charitable Trust, through its executive committee, has continued to actively raise funds to make the hospital a daily reality. There are many wonderful memories of annual fundraising functions, such as tonight, held throughout Birmingham and the Midlands. Through these endeavours, the hospital has become a great success and a beacon of healthcare in the area. Through links to Birmingham University, facilitated by Professor Robert Arnott, the hospital also provides an opportunity for the next generation of medical professionals from India and abroad to expand their learning in a rural environment. On the 1st of May 2015, the running of the hospital was handed over to the Christian Medical College and Hospital, Ludhiana. Medical missionary work began in Ludhiana in 1881 by Scottish evangelist sisters Martha Rose Greenfield and Kay Greenfield, joined by Dame Edith Mary Brown in 1893. These three women were not only pioneers in terms of medicine, but also guiding lights for women all over the world. Dame Edith Mary Brown was an English doctor and medical educator who, in January 1894, with the help of a £50 donation from a Bristol woman, rented an old schoolhouse in Ludhiana, Punjab. Here she founded the North Indian School of Medicine for Christian women, starting with just 4 students and 4 faculty members. The college was supported by significant grants from the Punjab government, as well as donations from women's auxiliaries in London, Edinburgh, Glasgow, and as far afield as Australia, Canada, the United States and New Zealand. It was a truly global enterprise. In 1911, the school was renamed Christian Medical College and Hospital, Ludhiana, though it opened its doors to all faiths in 1909. In time, it grew into a full college with medical, nursing and pharmacy schools and a hospital with 200 beds. During the partition of British India in 1947, Punjab was split between India and Pakistan, resulting in massacres of thousands in Ludhiana. Many Muslim employees of the college and hospital fled for Pakistan, while Sikh and Hindu refugees arrived over the border. Despite the violence, the college and hospital remained safe from attack and acted as an emergency centre for the seriously injured. Edith Brown served as principal of the college for half a century, and by November 1951, the college had graduated 411 doctors, 143 nurses, 168 pharmacy dispensers, and more than 1,000 midwives. The CMC has, over time, expanded its services and includes the Medical College, Dental College, College of Nursing, College of Physiotherapy, and Institute of Allied Health Sciences. The CMC has a keen interest in community health. For many years, it's reached out to the wider community by providing healthcare and education in urban and rural communities through clinics and medical camps. It's also been active in providing emergency healthcare in tragedies like earthquakes and train accidents. Since April 2003, a dedicated rural health outreach programme has been in place. This new initiative has started to provide a network of health services in the rural belts around Ludhiana. Clinics in surrounding villages are organised and managed under this programme. The Social and Preventive Medicine Department is very active in this programme. Community health centres in nearby areas which provide basic health care are managed by them. This outreach programme brings us to the affiliation with Bilga General Hospital, and a quote from Dame Edith Brown draws the goals of both institutions together. The patients in the hospital are very important to us. They are our esteemed guests. We are here because of our patients. The patients are not here because of us. We are committed to provide the best treatment and services, to bring healing in body, mind and spirit. We must endeavour to cure, comfort and care at all cost, as this is our utmost duty and the purpose of our being healthcare professionals. This year, the CMC is celebrating its 125th anniversary, and their history and work since their inauguration has made this affiliation a logical and easy to understand decision. Since becoming a unit of the CMC, Bilga Hospital has been able to provide clinical services with permanent residential consultants and regular visiting senior consultants. This affiliation has also allowed both institutes to successfully provide immunisation services as per the government schedule, with the first of the slums that were visited now achieving 100% immunisation. The location of the Bilga Hospital on the other side of the river Satluj has increased the reach of the CMC, and the affiliation has increased the services that we can offer. This has allowed both hospitals to continue to provide fantastic healthcare for the rural poor in an ever-expanding catchment area. Today, the CMC has a national and international reputation for exceptional healthcare. The hospital treats thousands every day, and the patients of Bilga General Hospital are safe in their hands. Bilga Hospital has entered a new era. For a village such as Bilga to have a campus of a major Indian medical school is quite an achievement, and the medical care of those it serves is now secure for decades to come. With your support this evening, we can continue to follow in the footsteps of Dame Edith Brown and provide care to those that need it. Thank you for your time and continuing support. Enjoy your evening, and let's create more wonderful memories of our fundraising together.